Ladies and gentlemen, His Excellency the Prime Minister of Ethiopia, Her Excellency the Chair of the African Union, please welcome their Excellencies, Prime Minister Hailemariam Desalegn and Chair Dr. Zuma. And welcome to this magnificent African Union Center building. I am Oying Ramon. I work with the Bill and Melinda Gates Institute for Population and Reproductive Health at Johns Hopkins University. Your Excellencies, distinguished guests, and participants, welcome to this historic Third International Conference on Family Planning. The largest ever gathering of political leaders, policymakers, scientists, researchers, civil society actors, faith-based leaders, donors, bilateral and multilateral organizations, individual citizens, all 3,300 of us coming from 120 countries. To begin this ceremony, let's start with the theme of this conference, full access, full choice. Can we play the video, please? Ronald J. Daniels is the 14th president of the Johns Hopkins University, the largest university recipient of federal funds, research funds in the United States. Johns Hopkins is home to 10 preeminent divisions, including the Bloomberg School of Public Health. The university's broad global reach includes campuses on 3 continents, presence in 150 field offices, and work in countries from Afghanistan and Zimbabwe to Haiti and Vietnam, and of course, Ethiopia. Before coming to Johns Hopkins, Mr. Daniels was provost and professor of law at the University of Pennsylvania. He was dean and James M. Torrey Professor of Law at the University of Toronto in Canada. He was elected a fellow of the American Academy of Arts and Sciences in 2009. In Baltimore, Mr. Daniels has focused his leadership on 3 overarching themes: enhanced interdisciplinary collaboration, increased student accessibility, and community engagement. In his role, he also serves as a bridge between the university and the vast Hopkins health system. Mr. Daniels is a law and economic scholar whose research focuses on the intersections of law, economics, development, and public policy, including the role of law and legal institutions in promoting international development. Your Excellencies, friends, Ron Daniels.
Thank you so much, Oying. Good afternoon, and welcome again to the International Conference on Family Planning. I'm delighted and honored to be joining you here representing Johns Hopkins University. I want to start by recognizing the Ethiopian government, which has not only demonstrated extraordinary hospitality in hosting this international event, but which also stands out as an exemplar in this policy field. Of course, I also want to thank the Bill and Melinda Gates Foundation for supporting life-saving family planning efforts around the world, and closer to home for supporting the Bill and Melinda Gates Institute for Population and Reproductive Health at Johns Hopkins, the co-host for this event. The distinguished lineup of speakers for this afternoon's session is powerful testament to the critical importance of this work, including His Excellency Haile Mariam Desalegn, Prime Minister of Ethiopia, and Her Excellency Dr. Nkosazana Dlamini Zuma, the Chair of the African Union Commission. I'm honored to join Dr. Babatunde Osatemehe, Babatunde Osatemehe, Executive Director of the UN Population Fund, and Dr. Kaseti Birhan Admasu, Ethiopia's Minister of Health. The Honorable Patricia Haslick, the UN Ambassador to Ethiopia, Dr. Chris Elias, President of the Global Development Program of the Bill and Melinda Gates Foundation, and Dr. Catherine Bonga Bayi, the delegate representing the youth sector. Of course, I'm also delighted to join the esteemed attendees of this conference who work tirelessly to ensure full access and full choice. I know today is about the future of family planning, but I hope that you will indulge me for a brief moment in a bit of time travel. Specifically, I want to take you back to Johns Hopkins' home city of Baltimore in the year 1927. It was a time when Johns Hopkins obstetricians were worried about the effects of frequent childbearing on their female patients. Contraception was considered controversial, and families and physicians were drastically hemmed in by both law and prevailing social mores. But in November of that year, 86 years ago this month, a small group of concerned citizens and Johns Hopkins physicians quietly opened the Bureau for Contraceptive Advice in a narrow, nondescript house near our hospital. The medical director was Dr. Bessie Moses, the first woman obstetrical intern at Johns Hopkins Hospital, and an impassioned advocate for family planning. Now, admittedly, though it was the first such clinic in the state, the Bureau did not bust open the floodgates of good reproductive health practices. Established hospitals, including Johns Hopkins, were wary of housing these activities within their facilities, and patients were largely restricted to married women referred by their physicians. But in the clinic's first 5 years, Dr. Moses collected data on more than 1,000 patients, later publishing a landmark study that provided dispositive scientific evidence of the benefits of birth control. Over the next 4 decades, as the clinic and the national discussion around reproductive health evolved in the US, Dr. Moses remained ever vigilant and in the vanguard of her field, using her formidable experience and expertise to lobby Congress, expand services, and train the next generation of practitioners. On the day that she died in 1965, our School of Public Health received a $700,000 grant, then what was clearly an outlandishly large sum of money from the federal government to advance studies of birth control. Now, I mention this story here today, 7,000 miles and 86 years removed, because I believe it echoes in this gathering today. This conference and the issues it raises stand as a resounding call for the Academy to be true to its roots, to follow in the footsteps of Dr. Moses and her peers, and to use evidence and compassion to illuminate best practice. Today, our academic researchers continue to hold a mirror up to family planning practices and interventions to determine whether they are justifiable against science, data, and human rights. This is true whether our investigators are working in Botswana, Bangladesh, or closer to home in the neighborhoods of Baltimore. There is no country exempt from the concerns of family planning, and no nation where science and evidence cannot add value to policy and practice. In the United States, our recent history discloses that vicissitudes of research funding and shifting political winds cannot help but disrupt research and cannot help but impair, tragically and unnecessarily, social health, and welfare. As in many parts of the world, family planning has too often been suffused with baseless ideology, despite the avalanche of rigorous evidence on the efficacy of certain practices. We know well that sound family planning is not easy, but neither should it be controversial. At the end of the day, I know the yeoman's work in family planning is undertaken by tireless community workers, scrappy nonprofits, and courageous, principled governmental leaders. Many of you, I know, are here today. I am delighted that Johns Hopkins can follow in the tradition that Dr. Moses began to stand by the side of these extraordinary men and women as we address the still gaping unmet needs in family planning. Thank you once again for being here at this conference and for all the work you do. Hopkins is humbled and privileged to play a small part in your great cause. Thank you so much.
Thank you, Ron. It is now my privilege to introduce my former boss in Seattle. When I was with the Gates Foundation, I have many mentors and bosses, so bear with me. Dr. Chris Elias is the president of the Global Development Program at the Bill and Melinda Gates Foundation, where he leads the foundation's work in innovative integrated delivery, finding creative ways to ensure that solutions and products get into the hands of people in developing countries who need them most. Dr. Elias' professional background is in health and medicine, even though he also oversees the foundation's agricultural portfolio. Prior to joining the Bill and Melinda Gates Foundation, he served as president and CEO of PATH, an international nonprofit NGO dedicated to improving the health of people around the world by advancing technologies, strengthening systems, and encouraging healthy behaviors. In the late 90s, Dr. Elias served as Population Council's country representative in Thailand, managing reproductive health programs throughout Southeast Asia. Earlier in his career, he spent 2 years in Thailand working in refugee assistance programs, first as a physician supervising a large pediatric ward in a refugee encampment, and then as medical coordinator for the American Refugee Committee at the Thailand-Cambodia border. As you can see, Chris is one of the most respected leaders in public health that I have known. He also came from the reproductive health and family planning community. This community. Chris, welcome back, though we know you never left.
Thank you, Ying, for that kind introduction. You have many bosses, but I think this week we all work for you. Prime Minister Haile Mariam, Dr. Kasete, Dr. Delima Zuma, Dr. Oshotemayan, President Daniels, Ambassador Haslek, Dr. Bai, ministers, distinguished colleagues, and friends. It's an honor to be here with all of you today. I'd like to thank the Ethiopian Ministry of Health and the Bill and Melinda Gates Institute for Population and Reproductive Health at Johns Hopkins University for convening us here this week for this important conference. It's great to be back in Ethiopia. Earlier this year, I had an opportunity to see firsthand what you saw on the video and to see how Ethiopia's innovative health extension program is working. The health post I visited was well stocked with contraceptives. It had an active family planning program, and in the previous 8 months prior to my visit, all but one of the 36 newborns in that area had been delivered at the health post or a nearby hospital. What I saw that day, and what you saw a glimpse of on the video, explains why Ethiopia has reached Millennium Development Goal number 4 early. Despite a sizable population and a shortage of doctors and other health professionals, Ethiopia's frontline health extension workers have helped to reduce the country's under 5 mortality rate by 2/3, well ahead of the 2015 target. With strong leadership and a commitment to family planning, Ethiopia has nearly doubled the prevalence of modern contraceptives in the last several years. And the government has been successful in ensuring that women have access to voluntary family planning services and a broad range of contraceptive methods close to where they live. We have a lot to learn from Ethiopia in both child survival and family planning. One lesson, of course, is the importance of family planning and access to contraception to achieving a broader maternal, newborn, and child health status and goals. Another lesson is the importance of sustained political commitment. Just over a year ago in London at the Family Planning Summit, the world came together in support of an ambitious goal, expanding access to family planning information, contraceptive commodities, and services to millions of women and girls in the world's poorest countries. 23 countries made commitments in London, and we are already seeing great progress in advancing these commitments. Over a quarter of the countries who made pledges in London have now launched costed national plans, and we expect additional countries to make new commitments in the near future. 10 countries have held their own national family conferences to begin to plan for meeting those goals. And political leaders are stepping up and taking ownership to advance and improve family planning programs and services. This is exactly what we need, sustained political commitment, much like we've seen here in Ethiopia. Family Planning 2020 is another important way that we're carrying forward the momentum of the London Summit. One essential aspect of FP 2020 is measuring the impact to make sure that we're on track to achieve our ambitious goals. This is a key area of investment for the Bill and Melinda Gates Foundation. Better measurement tools to capture data in real time, track progress, and help identify gaps in reaching women with contraceptives that meet their needs. Tracking progress will ensure that access and usage is voluntary, and it will help countries to improve their family planning services. Through a recent grant to the Gates Institute at the Johns Hopkins University, we'll pilot this improved data collection system in 10 countries, 2 in Asia and 8 here in Africa, including Ethiopia. And yesterday I had an opportunity to visit at the Gandhi Maternity Hospital with our colleagues from Johns Hopkins to see this new data collection in process and to see the benefits of more timely, regular, accurate information that allows us to track progress to our goals on a regular basis. Surveys will be done at least once a year, and the information will be shared within countries to help them continuously manage performance and to ensure information and services are of the highest quality. This really is a unique moment in time. Governments, donors, researchers, advocates, civil society, and the private sector have come together to put the needs of women back in the center of the global agenda. As a partner with all of you here, the Gates Foundation is in this for the long term. Family planning is one of our top priorities. We doubled our commitment at the London Summit, and we've added new leadership with Elizabeth Lulay joining us earlier this year as our Director of Family Planning. Tomorrow, Melinda Gates will share with you her thoughts on the progress that we've made to date and the challenges ahead. We all look forward to working with you in the months and years ahead to ensure that all women and girls have the opportunity to realize their full potential. Thank you.
Thank you, Chris. Now let me feel a little bit young, even if only in a vicarious way, by introducing the representative of the youth sector in this conference. Dr. Catherine Bonga Bay is a medical doctor with clinical experience in family planning from the Faculty of Medicine and Biomedical Sciences at the University of Yaoundé in Cameroon. Dr. Bay's leadership experience began in secondary school and continued through university, where she served as president of Cameroon's English-speaking Medical Students Association. She has worked with the family planning director of the Ministry of Health of Cameroon and is a current member of the Association of Young Medical and Paramedical Entrepreneurs, an association that promotes female education to combat HIV/AIDS, unplanned and unwanted pregnancies, and early marriage. Dr. Bay is serving as a youth delegate in this conference, and it's very interesting to tell you the process of selection. She was selected through an upload on YouTube, where more than 140 young people from all over the world uploaded, trying to convince the world that they should come and be part of this conference. If you have not seen her video, look it up at the conference website on YouTube. It is powerful, as many of the other youth in which their applications were also posted in the same YouTube. Dr. Bay is looking forward to a bright future as a public health specialist and a policymaker, and is here today as a voice of the compassionate young and the promise of the next generation of leaders. Let me just say that this conference is also historic. It is historic because this is the largest contingent of young people ever in an international family planning conference. At least 350 of you are here, and you can call this conference as the Youth Family Planning Conference. It is a pleasure to have Catherine with us today.
Thank you. All protocol respected, dear youth, ladies and gentlemen. On behalf of the youth participants at the International Conference on Family Planning 2013, who are here present, we welcome you. We are honored and delighted to be part of the largest family planning conference ever held, bringing together people of all age groups, races, nations, and areas of employment. We are all people coming together as one for one cause. Full access, full choice for contraception for all, because family planning saves lives. It is a pleasure. It's a pleasure to be in the much spoken about and historic African Union Center in this very beautiful city. What a great choice for such a remarkable conference. As youth, we are pleased to be given an opportunity to share, learn, and be heard. Youth are the best group of people for a country to invest in, but nobody will invest in failure. Thus, as young people, we need to be equipped with the skills and resources so that we can express the potential that we have in us. If nurtured and supported, youth are a great resource for families, communities, and countries. Adolescent pregnancies, unwanted pregnancies, poorly spaced births are becoming a disturbing concern that requires urgent redressing, given the economic, social, and political implications. For some of you, it may seem youth have always had these same challenges, but I tell you, this one is different. At about 1.8 billion, today's youth are the largest generation ever to transition to adulthood. In developing countries, youth make up 30% or more of the population. In sub-Saharan Africa, half of all births to women under age 20 are unintended. About a quarter of all young married women have unmet need for family planning. We youth are ready to make changes. We are ready to save lives, help increase standards of living, and contribute to the achievement of the FP 2020 goals. But to be successful, youth need information about and access to reproductive health and family planning. We then will approach our peers. That is why we're here, to be equipped and prepared to be informed champions for contraception. Mastery of family planning methods that ensures accessibility to family planning services and acceptability of family planning methods and the existence of youth-friendly family planning services in our nations will improve the health of our nations. It is because of the power that family planning has to influence every single level of a nation that I have committed myself to this cause. Generally, and especially in Africa, youth are paying attention to politics. We look up to political leaders. The involvement of political leaders who have a sustained commitment to family planning will engage young people and capture their attention. As youth, and also as youth communicators, we have the opportunity during this conference to be equipped and eventually be able to dispel misconceptions, dissolve doubts, answer questions, and ensure clarity of information. The importance of accepting, appropriating, and understanding family planning cannot be overemphasized. Let's together make history by the impact and changes this conference will bring about. Thank you.
Thank you, Catherine. Now, let me introduce my boss, my mentor, and my friend in Ethiopia. His Excellency, Dr. Kesete Berhan Admasu, is the Minister of Health of the Federal Democratic Republic of Ethiopia. Prior to his appointment as Minister in November 2012, Dr. Kesete served as State Minister of Health, the Program Sector, and Director General of Health Promotion and Disease Prevention. In his capacities as State Minister and Director General, Dr. Kesete oversaw the health sector reform program and led the implementation of the country's flagship program, the Health Extension Program, which significantly expanded the coverage of public health services in Ethiopia. Dr. Kesete has been spearheading the establishment of a health development army of over 3 million to ensure the massive social mobilization for healthcare services through participatory learning and action approaches. The Health Development Army is regarded as the key vehicle that will help Ethiopia achieve its ambitious 5-year health sector development program targets and Millennium Development Goals. Dr. Kesete has championed a number of innovative approaches in delivering maternal and child health care services, task shifting, and implementation of a large-scale healthcare intervention, such as the rollout of the integrated community case management of childhood illnesses and insertion of the single rod implant through the Health Extension Platform. While Chief Executive Officer of the largest public psychiatric facility in Ethiopia, Dr. Kesete's leadership in transforming how psychiatric services are delivered has become a model for scaling up the delivery of mental health care in the world. Dr. Kesete has also been nominated as an outstanding 2013 Harvard Health Leader, part of the Ministerial Leadership in Health program at Harvard University. I'm not sure where Harvard is. I'm just kidding. As a medical director by training with a master's in public health, Dr. Kesete has dedicated his entire career to public service and scientific research focused on major health problems in Ethiopia. It is my honor to introduce, as you will agree with me, one of the most humble, soft-spoken, approachable global leader in public health with the most endearing smile, too, to add. Dr. Kesete Birhan Admasu, the young and dynamic Minister of Health of the Federal Republic of Ethiopia.
Thank you, Oing, for your kind words. Don't listen to him. He's my friend. He always speaks, good things about me. Your Excellency Prime Minister Haile Mariam Desalegn, Your Excellency First Lady Wezero Roman Tesfaye, Your Excellency Dr. Dlamini Zuma, Chairperson of the AU Commission, my friend, UNFPA Executive Director Dr. Babadunde, another friend from Bill and Melinda Gates Foundation, Dr. Chris, honorable ministers, distinguished members of parliament, distinguished representatives of development partners, excellencies, ladies and gentlemen. It gives me great pleasure to speak today on the opening of the third International Conference on Family Planning. I would like to thank you all for accepting our invitation and being here with us today. Honorable Prime Minister, Excellencies, ladies and gentlemen, back in June 2011, Ethiopia accepted to host the third International Conference on Family Planning in Addis. After going through all the hard work and preparation that took about a year, the conference has now become a reality, thanks to the tireless effort and collaboration between the national and international organizing bodies. This International Conference on Family Planning aims at examining cutting-edge programs and research that are helping to advance the health and wealth of families and nations worldwide. This conference is a platform to advance family planning policies, share best practices and new innovations, and recommit ourselves to make family planning a decisive development agenda across the globe. Most of all, this third international conference is a moment for all of us to appreciate the hard work and celebrate our success. As you know, during and shortly after the June 2011 historic London summit, countries signed the pledge committing themselves to reach millions of women with family planning and reproductive health services. Together, they stood up and declared that all women must have access to family planning services. A year and a half into our Family Planning 2020 commitment, countries have now the opportunity to present some case studies and success stories to show how they have improved access to family planning and reproductive health services, and I believe every country has best practices to share. Excellencies, ladies and gentlemen, exactly a year ago, more than 500 participants comprised of policymakers, parliamentarians, development partners, academia, researchers, and youth participated in our first ever National Family Planning Symposium and declared that family planning is not only a priority for the health sector in Ethiopia, but a national development agenda. On our national symposium, we called upon all stakeholders to accelerate the momentum, empower youth and women, and increase investment on family planning programs. We jointly committed ourselves to reach 11.2 million women in Ethiopia by 2020 to benefit from family planning programs in accordance with the pledge made at the London Summit. Ethiopia has dramatically improved access to modern family planning services and registered notable achievements in the effort to improve access to family planning services. As you have seen from the video, our contraceptive prevalence rate has increased by nearly fivefold in the years 2000 to 2011. These achievements were possible because of the high political commitment, strong leadership of the health sector, and unprecedented global support by our development partners. At the center of all the successes in the health sector are the right policies, strategies, and programs that are put by our government. The role of our flagship program, the Health Extension Program, which embraces more than 38,000 government-salaried health extension workers, has been pivotal in the achievement of remarkable results such as increase in contraceptive prevalence rate, the achievement of MDGs 4 and 6, well ahead of the deadline 2015. To consolidate the gains we have made so far and foster community ownership, we are currently implementing an organized movement of the community, particularly women, through participatory learning and action meetings, which we refer as the Women-Centered Health Development Army. The Health Development Army is an effective tool to massively mobilize the community and address cultural, attitudinal, and social bottlenecks that hinder uptake of critical services. Through this homegrown initiative, we are trying to mobilize around 3 million women volunteer leaders to work alongside with our health extension workers and bring social transformation in each community in Ethiopia. Despite all the achievements and progresses we have made, there are still a lot to do, and there are more women to be reached. We have to reduce the unmet need for family planning and reach an additional 6.7 million women in Ethiopia who want to avoid pregnancy but are not using family planning. And most of all, we need to join hands and meet the huge financial gap to ensure contraceptive commodity security. Excellencies, ladies and gentlemen, Ethiopia has demonstrated that with country ownership, sustained political commitment, and effective strategies, there is hope for dramatically improving access to voluntary family planning services and reduce the unmet need. During the Dakar conference 2 years ago, I had the privilege of giving a closing remark, and I talked about 4 important issues. Allow me to repeat the most important element, which is country ownership. Country ownership is the surest way for developing countries to chart their own courses of development and overcome the challenge they face in building effective and productive states. Ownership reinforces commitment, and commitment in turn yields results and assures long-term sustainability. In Ethiopia, we couldn't have achieved such encouraging progress in our health sector without this type of genuine ownership and the space to pursue an approach to service delivery on the basis of health system strengthening. The principles and actions that need to be taken toward this country ownership are neither new nor particularly difficult to understand. Countries simply must be on the driving seat for the effect of development aid to be maximized, with no backseat drivers, of course. What seems to be missing is partners' full commitment to country ownership. Partners have a wide range of interests that hinder them from fully embracing country-led processes. But a decisive shift has to happen now if the MDG targets are to be reached. We urge all development partners to move forward in a new spirit of candor and partnership to make country ownership a reality. That way, achieving the MDGs and our Family Planning 2020 goals will become a reality too. Excellencies, ladies and gentlemen, I finally call upon all the countries to honor your pledge with firm local commitment, national plans and budgets, but most importantly, with action. We have had similar conferences in the past. Now is the time to walk our talk. Let's join hands to make the world a better place for women, children, and youth. We can translate women's rights to women realities. It is my strong belief that this conference will enrich the experiences we have at the ground and will assist countries and all stakeholders in their endeavor to improving access to and broadening choices on family planning services. I wish you a successful conference and an enjoyable stay in Addis. Thank you very much.
Thank you, Dr. Casete. This time, what a privilege to enjoy to introduce my boss in New York. On January 1st, 2011, Dr. Babatunde Osotemihin, a physician and public health expert, became the 4th executive director of the United Nations Population Fund and the first from Sub-Saharan Africa. He holds the rank of Undersecretary General of the United Nations. Before his appointment, Dr. Osotemihin was Nigeria's Minister of Health. Prior to that, he was Director General of Nigeria's Agency for the Control of AIDS, which coordinates HIV/AIDS work in the country of more than 160 million people. Dr. Osotemihin is a qualified physician from the University of Ibadan, Nigeria, and went to the University of Birmingham in England, where he got a doctorate in medicine. He was appointed professor at the University of Ibadan in 1980 and was elected provost of the College of Medicine in 1990. Dr. Osotemihin received the Nigerian national honor of Officer of the Order of Niger in December 2005. But for all of us who have met Dr. Babatunde, he is simply known to us as Prof. At UNFPA, he has introduced major reforms to make the fund more focused and results-oriented, as well as intensified efforts to promote the rights and ability of young people to build a better world in the context of sexual and reproductive health. He has been a champion of Family Planning 2020, and as many of you know and have personally experienced, he possesses a unique quality and comfort level in either dealing with the heads of states, field workers, or even the beneficiaries of reproductive health programs. Your Excellencies, friends, colleagues, our global leader and champion, Prof.
Thank you very much, Oyin. And when a man stands up and talks about 10 bosses, you must wonder who does he report to? And does he do it by matrix system? I wonder. But thank you very much. And let me start by saluting our esteemed Prime Minister, Haile Mariam, who is the chair of the African Union, Madam Zuma, the chair of the African Union Commission, also a physician, and a leader in this field. Dr. Kesete, thank you for your leadership. I'm going to come back to some of the things you said. Mr. Daniels, I don't think you should worry about pronouncing my name. It's a common feature. When I was in school in England, if I went to a tutorial and we all sat down and the tutorial teacher starts to pronounce Dr. White, yes, I'm here. Dr. Brown, I'm here. Dr. Owen, I'm here. And then when it gets to a point where it becomes a phasic and says doctor, and it goes off, I just say I'm here because I know that's my name. Chris Elias, my friend, and the representative of the now generation, Catherine. Thank you very much for what you said. Now, I'm so happy to be here because I think that being part of this meeting, which is putting together the largest number of people that has ever attended the Family Planning Summit, is a tremendous thing. And I think it is not just a coincidence that is happening in Africa, because I'm going to talk about that later, because Africa needs family planning. And we must make sure it happens in Africa. Let me also say that, as Onya said, 350 young people here, given the fact that one of the achievements and one of the deliverables we want in this meeting is about young people. That in itself is one thing that we must celebrate. I want to start by thanking the government of Ethiopia and the organizers. And Oyi, you deserve a special thanks. Please clap for him. And it's so good for us as UNFPA to be one of the stakeholders and to be here today. The history of the conference comes as an important moment in time with good momentum. And as I said, UNFPA has been part of this from the very beginning. Kampala, Dakar. Now, we've had, and we were part of the FP 2020 movement. And I think that's generated a lot of momentum. And let me thank Chris Elias and the Bill and Melinda Gates Foundation and DFID for providing leadership for that. And then, of course, now we are in Addis. And basically, I think that the momentum we've created, in addition to what UNFPA has done in the past and continues to do, are things that we must celebrate. We have worked in Ethiopia, and I want to congratulate Ethiopia for what it's been able to achieve, taking this contraceptive prevalence rate to 27.3% in 2011, from 13.9% in 2005. And of course, being able to achieve the MDG 4, I think it's also something which we must celebrate. Haiti, where we work, recovering from a devastating earthquake, has taken its CPR from 6% to 24.8%. And now that in 2009, 2006, and now 31% to 2012. I think one of the most dramatic has been in Laos, which has gone from 8% to 43%. So basically, things are happening around the world, and I believe that all of us need to celebrate this and understand that we collectively have a responsibility to be able to do this better. Now, let me now speak to something which I feel passionate about, but which I believe gives us the opportunity, because we are in Africa, to talk about. And that is the issue of the demographic dividend. Africa is right to go. Africa today is growing fast. 7 out of the 10 fastest growing economies in the world are in Africa. But that's not enough. That's from extractive industry. Africa needs to grow its young people, and Africa needs to build human capacity. And so the youth of this continent, which is a large contingent and a large sector of population, needs to have all that it has to have. Africa must harness this and must do so in such a way that it can have a second growth after the extractive industry must have gone. Now, but we cannot do that if we don't invest appropriately. Invest in education, education fit for jobs, education fit for market, skills development. We must ensure that young people are able to hold their own, their agency, be who they want to be. And it can only happen if they can exercise their rights. It can only happen if they can exercise their rights. But I think more important, which is what I would like you to go away with today, is that for as long as we marry our girls out at 12, for as long as we have teenage pregnancy in the kind of epidemic we have it in this continent, for as long as we have such a violation of the rights of the girl child, we're not going to get there. But I believe we can, and I believe we will. I don't think there's any parent in this audience who will be happy to see his 11 or 12-year-old get a fistula or be paralyzed because they are children. Let us stop teenage pregnancy. Let us stop teenage marriages. And we can do it. Much of what we know today about adolescents is about the 15-year-old and above. We don't know much about the 10 to the 14. They disappear. Many of them are married off. Many of them don't have any agency of their own, and I think we must stop that, and we must make sure that we would continue to look after them and make sure that they become part of this. Now, let me now come to a point where I believe I need to talk to you about something which you might have seen, and that is that in the last few weeks, we actually launched a report on the SWOP, our State of the World Population Report, which talks to teenage pregnancy. 7.2 million girls a year get pregnant in the world. 7.2. I mean, can you imagine? 200,000 every day. Now, we need to stop this. We know what to do, and we must do it. Now, and I think that that SWOP report is not just about pregnancy, it's about the rights, it's about enabling women and girls, it's about gender equality, and it leads us to look at things in a totally different way. When I talk about what we, all of us collectively, are going to do in the post-2015, we would all have to come back to that. Investments in girls, investments in their education, investments in their health and sexual reproductive health and comprehensive sexuality education. Let me now depart from that and thank you all, because in 1994, 179 countries around the world decided to sign off on the Cairo Agenda. And the 179 countries have since reviewed what they've done in 20 years. Indeed, we have actually 180 countries that have reviewed it. And what they've come up with are really outstanding issues around sexual and reproductive health and rights. And clearly, from what we have, from the global report and various things, the world has recognized the importance of investing in women and family planning. The world has also come to understand that these are things that we need to do, just making sure that we can and should be able to invest properly in girls and in women. Now, so going forward and being able to do what we have to do, there are a couple of things that I want to leave with you today. The ICPD and the Cairo Agenda Review should not be seen in isolation. I think it's auspicious that we're doing this at a point where the world is actually looking at the next development agenda. But before we get there, I want to remind you that today we still have 700 days to meet the MDGs. So let's go back. Let's go back to our countries. Let's go back to our missions. Let's make sure that women still get access to family planning. Let's make sure they stop dying giving birth. Let's make sure girls stay in school. Let's make sure that they reach their full potential. 700 days is a long time. We can still make a difference with that. But beyond that, I want to leave with you three things. Three things and three opportunities for all of us to input and address and affect the next development agenda. First of all, an overarching principle of human rights is important. Without rights, there cannot be development. Without rights, there cannot be development. And there must be equity. There must be social justice, and there must be gender equality. Those are overarching principles. Now, when it comes to specific goals, I'm going to leave with you. UNFPA aspires to have a youth goal, because it's only a youth goal that can address all of the issues that affect young people. Their education, their health, their comprehensive sexuality education, access to contraception, their choices, their rights, and their ability to get jobs.
Thank you very much. It is an honor to introduce Dr. Zuma, Commissioner of the African Union. Dr. Dlamini Zuma is a lady of noble character, a visionary leader with an incredible passion for the African continent, its developmental ambitions, and is a champion of the Renaissance of Africa. Working as part of the ZANE Organization for the African Union Collective, she participated in a number of OAU delegations as a midwife to peace, stability, development, and prosperity to the African continent. She has also led a number of peace and security initiatives to the Democratic Republic of Congo, the Union of the Comoros, the Kingdom of Lesotho, to mention but a few. A woman of great strength and vision, Dr. Dlamini Zuma has held various high-level portfolios in the South African government as a Minister of Health, as a Minister of Foreign Affairs, and as a Minister of Home Affairs. Dr. Zuma's impressive academic life has been equally expansive and spans 2 continents, having obtained degrees in South Africa at the University of Zululand and the former Natal during the 1972 to 1976, and University of Bristol in England and Liverpool School of Tropical Medicine. Without further ado, I invite Her Excellency Dr. Zuma to take the floor and give us her blessing.
Thank you very much for that kind introduction. Your Excellency, Prime Minister of the Federal Democratic Republic of Ethiopia, and our chairperson of the African Union, and our fellow speakers, ministers, MPs, distinguished participants, especially the youth. It's good to know that the youth is here. And a very warm welcome. I know you've been welcomed to Ethiopia, but I want to welcome you to these headquarters of the African Union and hope that you feel at home, because of course, Africa and Ethiopia is the cradle of humanity, so cradle of humankind, so this is your home. And I'm indeed very honored to address the 2013 International Conference on Family Planning. And I'm very glad to hear that this is the biggest gathering ever of people coming to discuss family planning. This is an important conference, coming as it does at a time when Africa is celebrating the 50th anniversary of the founding of our organization. And is therefore time to reflect on the past, the present, but more importantly, to plan for the future, as our friend there and our brother Babatunde has already taken us beyond 2015. Family planning is critical. And since the African people, and it's very critical for Africans in particular, as he said, that this is very important that this conference is taking place here, because it is the center for development, in my view. Without family planning, Africa cannot reach its full potential in terms of developing. And of course, in that development, our families should be at the center. And our vision for the future that we want, family planning must accompany that future. It should therefore be placed in its proper context, in a broader discourse of the social, political, cultural, and economic transformation of our continent. Of course, Africa's population is set to double over the next few decades, reaching nearly 2 billion by 2050. And of course, as it's known, most of the population is young. And of course, half of that population is women. So the African continent, when it talks about family planning, and all of us should go beyond the issue of population explosion, but instead, we must talk about it in the context of investing in our people, because our people and our women are the most precious resource any nation has. So our starting point is thus that family planning and our quest for should be part of our quest for women's emancipation. And the two are inextricably linked. We must therefore ensure that boys, of course, girls as well, go to school. But girls must go to school and remain in school for as long as is possible, until they finish their education, before they decide to have babies. The continent is making progress on gender parity, on education, especially in primary school in most countries, but we must continue to push to ensure that girls go to school and stay in school. and that we further expand their access to skills development and higher education. Just as Dr. Babatunde said, we must do away with child marriages in Africa and elsewhere. We have committed ourselves to do this, including the legal obligation to end child marriages. Girls who end up as brides at a tender age are coerced into having children, whilst they are still children themselves. Children's bodies are simply not mature enough, both for early sexual experience, but more importantly, for pregnancy. So child marriages, early and teenage pregnancies interfere with girls' education, their acquisition of skills, and therefore their ability to be economically independent. Babies born from children and teenagers also have a lower survival rate. We also know that educated women means families with better health and nutrition, and children with a better chance for education and survival. The African skills revolution that we are talking about cannot happen if it does not also target girls and women. Therefore, family planning is important for their education, for their health, for women's emancipation, and it is a reproductive right. And women's rights are human rights, and this is one of the rights that we must defend. And it is important for the empowerment of women because they must decide when they want to have their children, how many children they want to have, and what space do they want between their children. Because we know that spacing children not only allows more time to breastfeed, but also time for the body to recuperate after pregnancy. And better spaced children have a higher survival rate than those who are very closely spaced. And by spacing their children, women will have fewer, healthier children that they can afford to look after and to send to school. It is well understood that a drop in fertility rates often follows significant reductions in child and infant mortality rates, as well as an increase in average life expectancy. So family planning is not just about fewer kids, it's about the total integrated development of both human beings and the countries. Therefore, we have to promote family planning, including the use of condoms. And this must be part of education that we give to young people to reduce infant mortality, to prevent spread of sexually transmitted diseases, including AIDS, and of course, reducing unintended pregnancies and teenage pregnancies, and reducing unnecessary deaths. And also, this will take the burden from the health services. We must also educate boys and men about family planning, the dangers of unprotected sex, of multiple partners, and about importance of spacing of children. This brings us back to the central issue that family planning must give women the power to exercise their reproductive rights. It is more than a health issue. It is a social, cultural, political, and economic issue. And therefore, it is very important and paramount that all of us support family planning. Our governments must support family planning. But before I conclude, I just want to express our profound appreciation to all those who have helped to organize this conference, because it's so important. And my special thanks goes to the government of the Federal Democratic Republic of Ethiopia and its government, led by the Prime Minister and the Minister of Health here, the Gates Foundation, Johns Hopkins, development partners, both bilateral and the UN system, and their diligence and hard work in facilitating this important event. And the last word goes to the youth, and we appreciate the youth goal that we are proposing. We appreciate the gender goal that we are proposing. But I just want to say to the youth, we always say youth is the future. But youth is going to inherit the future that we bequeath to them. So I'm saying to the youth, you might as well start shaping that future now. Get involved now. Don't wait for tomorrow. Thank you.
Thank you, Dr. Zuma. Now I have a great honor to introduce my boss, His Excellency the Prime Minister of the Federal Democratic Republic of Ethiopia, Haile Mariam Desalegn. Mr. Haile Mariam is an engineer by training. He has also masters in organizational leadership. His Excellency the Prime Minister has extensive experience in academic environment. He has served as professor and Dean of Arba Minch University for over 12 years. His Excellency has served as a Vice President and later on as President of the Southern Nations, Nationalities, and Peoples Regional State, one of the 9 regional states in Ethiopia from 2000 to 2006. Later on, he was brought into the federal government and appointed as a special advisor to the late Prime Minister Meles Zenawi on social affairs, civic organizations, and partnership with the rank of minister, serving in the capacity from 2006 to 2008. Shortly after, he became the government chief whip in the House of People's Representatives with the rank of a minister from 2008 to 2010. In September 2010, he was appointed as a Deputy Prime Minister and Minister of Foreign Affairs, and he served in that capacity for 2 years. After the untimely demise of the late Prime Minister Meles Zenawi in August 2012, Mr. Haile Mariam Desalegn was elected as the chairperson of the ruling party and subsequently was sworn in as the Prime Minister of the Federal Democratic Republic of Ethiopia. His Excellency Prime Minister Haile Mariam is a very known advocate of health in general and family planning in particular. I will give you one example. When he was the president of Southern Region, he was the first president to introduce a line item budget for family planning commodities into the regional government's budget. Another example, when we started our planning for this budget year, I asked the Prime Minister, what should the priority of the health sector be? And he clearly told me, improving the health of women and children is a top priority in Ethiopia. As a father of 3 daughters, you can imagine that improving the health of women and children is closer to his heart. Without further ado, it is really my honor to invite the Prime Minister of Ethiopia to give a keynote address. Prime Minister, you have the floor.
Your Excellency, Dr. Dlamini Zuma, Chairperson of the African Union Commission, Dr. Baban Tunde. I think I was thinking whether I could spell it well or not, but he's my good friend, and I seek his apology. Mr. Ronald Daniels, Dr. Christopher Elias, Dr. Catherine Bonga Baye, which is, of course, an Ethiopian name. I do not know why it has been there in Cameroon, so we have to see the source. Honorable ministers, distinguished members of parliament, representatives of partner agencies, distinguished guests, ladies and gentlemen. On behalf of the government and the people of Ethiopia, allow me to express my warmest welcome to all of you to Addis Ababa. It is a great honor for Ethiopia to be hosting this historic event on family planning, where more than 75% of the participants are composed of youth and women in equal measures to the proportion of our population in the sub-Saharan Africa. Hence, I want to express my appreciation to all those involved and worked hard to organize this landmark event for a job well done. Again, thank you for all your efforts and for inviting me to say a few words in this important event. Excellencies, ladies and gentlemen, first allow me to applaud your efforts and the efforts of your governments as you take time off from your busy schedule to be here with us today to deliberate on family planning matters, and for your enduring contributions and leadership in the area of family planning and of reversing maternal mortality. Let me also take this opportunity to recognize the leadership and commitment of the Bill and Melinda Gates Foundation and UNFPA. Thank you for your steadfast and unwavering support on family planning. Your organizations remain among Ethiopia's most valued and long-standing development partners. Let me also say a few words about our presence here and the significance of such a very large international gathering on family planning to ensure the maintenance of a strong momentum. As many of you know, the Millennium Development Goals progress chart so far shows a mixed picture, with many encouraging progresses, but also with some serious challenges. And MDG 5, which is about improvement of maternal health, remains among the biggest challenges we face. However, the significant global momentum to support maternal health we have been over the last few years inspires a renewed sense of optimism. This conference on family planning follows a number of major international and regional gatherings over the last year, events which have focused on the world's attention on family planning, as well as reproductive health like never before. Following the historic London conference, the momentum around family planning has been building up in various countries across the globe. Countries are making great strides in recent years, moving rapidly towards the achievement of the Millennium Development Goal, that's Goal 5B, which calls for universal access to reproductive health, including family planning. For example, Ethiopia, Malawi, and Rwanda have shown a dramatic increase in contraceptive prevalence rate of modern methods among married women of reproductive age. Given these successes and the remarkable progress we have made together over the past years, it is indeed an appropriate time now to take note of our achievements. These achievements have been acknowledged by different actors, and most of all, among the people we serve. And it is this heightened momentum and the strong show of commitment by world leaders on MDG 5 that leads all of us to believe that the final sprint will be the real turning point for accelerated progress on reproductive health. Excellencies, ladies and gentlemen, Ethiopia has registered significant progress in socio-economic development over the past decade. Our 5-year development blueprint, known as the Growth and Transformation Plan, aims to foster broad-based development in a sustainable manner to achieve the MDGs. We envisage a major transformation of the national economic structure, emphasizing investment in economic and social services and infrastructure, while maintaining a specific focus on human development, women's empowerment, and governance. Improving access and broadening the range of choices to voluntary family planning services in a way forms part of this endeavor. In addition to the health and economic benefits, family planning is considered as one of the basic human rights enshrined in Article 35(9) of our Constitution. In addition, family planning use is clearly stated in various policies such as our women's policy, population policy, and other policies issued by my government. Ethiopia has set in its growth and transformation plan to reach more than 6 million women with family planning services by 2015, an additional 5 million by the year 2020. My government will also recommit itself to meet Family Planning 2020 goals with a target of reaching a total of 11 million women with family planning services. To this end, my government's continued commitment will be reflected in the increased budget for family planning at federal and local government levels. In conjunction with the comprehensive health delivery system that we have put in place in the last 10 years, I am confident that our goals for expanding family planning services to our citizens will be realized. Moreover, we have also been rapidly expanding access to basic health services, both through a major government-led effort to rapidly increase the number of well-equipped health facilities throughout the country, as well as through our countrywide health extension program, which has trained and deployed a massive cadre of over 38,000 health extension workers in communities across the country, 2 for every village. And the effectiveness of our health extension program has also been enhanced by an organized movement of women through participatory learning and action meetings known as Women-Centered Health Development Army, as the minister said. Excellencies, ladies and gentlemen, the world has made tremendous strides in achieving health status and health care in the past decades. However, progress has been slow. Countries affected by conflict and chronic emergencies face additional challenges and delays in achieving their MDGs. To attain improved reproductive health and family planning services for nations across the world, our pledges require universal and quality maternal health services and improved primary care, and our pledge depends upon a well-functioning health care system, and they require overall social and economic development, peace and stability, and good governance. To conclude, let me reiterate that we are all have a shared responsibility, and it's my firm belief that such a large international gathering on family planning that we are having today creates the right platform to share experiences, best practices, and innovations, and hence to make effective use of available resources for greater results. Once again, a very warm welcome to you all, and I wish you fruitful deliberations and a very pleasant stay in Addis Ababa, the African capital. I thank you.
A 3-minute relaxation while we bid farewell to the Prime Minister and Madam Zuma. We will reconvene in 3 minutes. If you feel warm, you have your fans with you. And to all our colleagues who are in the overflow room, we can't see you, but we say hello to you. Tell Juliana that outside we might probably we might probably 6:15 finish at about 6:45, not 7. So if just that to get them ready outside. Media. You have to ask his yeah. You have to ask I think that there's a minister in the public affairs.
Wonderful. The people are moving out, so they are not expected to go out, right?
Yeah.
They are not expected to go out.
Please remain in the room if you can do it. We will resume in a few minutes. You're allowed to go out of the room only for personal reasons. Thank you. Use the video message from the Honorable U.S. Secretary of State, John Kerry, who cannot join us today. Ambassador Haslak was sworn in as a U.S. Ambassador to Ethiopia only about 3 months ago. She previously served as Principal Deputy Assistant Secretary in the U.S. Department of State's newest bureau, the Bureau of Conflict and Stabilization Operations. Prior to this, Ambassador Haslak was the State Department's coordinator for Iraq transition in the Office of the Deputy Secretary for Management and Resources. Ambassador Haslak brings with her a long career dealing with development issues in countries undergoing transition. She served as a Deputy Coordinator for Diplomacy for the U.S. Global Hunger and Food Security Initiative, that's the Feed for the Future program, and visited Ethiopia in that capacity. She was ambassador to the Asia Pacific Economic Cooperation Forum, APEC. This is a large group of countries. Ambassador to the Lao People's Democratic Republic. She has also served as economic counselor in Pakistan and deputy economic counselor in Indonesia and Nigeria. I like this one. Ambassador Haslak has 2 daughters, Shireen and Kiran. Your Excellencies, friends, Ambassador Haslak.
Thank you. Thank you, Jose. First of all, I'd like to welcome my colleagues. Thank you very much for your remarks, Dr. Elias, Dr. Babutunde, Mr. Daniels, and of course, Dr. Bai. Excellencies, distinguished guests, ladies and gentlemen, I'm pleased to introduce this short video containing a message on family planning from U.S. Secretary of State John Kerry, my boss. As some of you have heard me say yesterday at the ministerial event, there have been great achievements in family planning, but there is still more work to be done. Helping women and young people make reproductive decisions that will improve their own health will lead to greater opportunities and more economic growth. I'm encouraged to see so many attending this conference to discuss this important issue, especially the 350-plus delegates, youth delegates represented by Dr. Bai. Thank you very much. You will soon hear Secretary Kerry, as the father of 2 young women, extend his gratitude for your hard work and dedication to this cause. As the mother of 2 beautiful daughters myself, I would also like to extend my thanks to all of you for your dedication to improving the reproductive health and rights of women. Thank you for the work you have done and continue to do. We talked about the demographic dividend. I think there's another word we should use today, and that should be the multiplier. I can't believe how many people are here, and I can only imagine the multiplier effect of what you're going to be discussing and the contributions that you're going to make. So we hope this will ultimately lead to thriving families and communities and a more prosperous future. Now for Secretary Kerry. Thank you.
We thank Secretary Kerry for his message. Now let me introduce Her Excellency President Joyce Banda, a woman I admire a lot, and I had the privilege of listening to her in a number of international forums, and she is a powerful, powerful lady who speaks her mind. Her Excellency President Banda is the President of the Republic of Malawi. She took her oath of office on 7th April 2012. She is Malawi's first female president and Africa's second female head of state. She holds a Bachelor of Science. She holds a Bachelor of Science in Gender Studies from the Atlantic International University in USA.
እሺ አመሰግናለሁ ይህንን እድል ስላገኘው። እንደምን ዋላችሁ። በሀገራችን በመጀመሪያ ሰላምታ ስለሚቀደም ደግሜ እንደምን ዋላችሁ እላችኋለሁ። በኢትዮጵያ ውስጥ ከሚገኙ ከ38,000 በላይ ከሆኑ ከጤና ኤክስቴንሽኖች ሰራተኞች ውስጥ አንዷ እኔ ነኝ። ስሜ ንግስት አበበ ይባላል። ከኦሮሚያ ክልል ከምስራቅ ሸዋ ከቦሰት ወረዳ ደንጎሬ ፉርዳ ቀበሌ ነው የመጣሁት። በስራዬም ላለፉት 8 አመታት አገልግያለሁ። ባለፉት 8 አመታት ሳገለግል ወደ ቀበሌው ስገባ ስለ ጤናም ሆነ ስለ ቤተሰብ እቅድ አገልግሎት ምንም ያውቁት ነገር የለም ነበር። በአቅራቢያቸው ጤና ኬላም የለም። ሌላ የጤና ሰርቪስ ለማግኘት ወደ ሩቅ ጤና ጣቢያዎች ነበር የሚሄዱት። በቀበሌያችን ውስጥ 6455 የህዝብ ብዛት ሲኖረኝ እኔ የምሰራው በ16ቱ ፓኬጆች ላይ የግል ንጽህናን እና የአካባቢ ንጽህናን፣ የትምህርት አገልግሎት፣ የተላላፊ በሽታዎችና የቤተሰብ ጤናን አገልግሎት ትምህርት በመስጠትና በመከላከል ላይ ከፍተኛ ትኩረት ሰጥተን እንሰራለን። የቤተሰብ ጤና ውስጥ ከምንሰራው አንዱና ዋነኛው የቤተሰብ እቅድ አገልግሎትን ነው። የቤተሰብ እቅድ አገልግሎት በማህበረሰብ ውስጥ በመናሰርጽ ጊዜ ህብረተሰቡ የተለየ እምነት ነበራቸው። የቤተሰብ እቅድ መጠቀም ማንነትን ያስከትላል። በሃይማኖት አባቶች ላይ ደግሞ ኃጢአት ነው ብለው ይሄ ስራ ደግሞ ይሄ የቤተሰብ እቅድ የሴቶች ብቻ ብለው ያስቡ ነበር። ይሄንን በመለወጥ እኔ የምሰራውን ለረጅም ጊዜ ኢምፕላኖልን፣ ዲፖ ፕሮቬራን፣ ፒልስና ኮንዶምን የመሳሰሉትን ለህብረተሰቦቼ እኔ አቀርባለሁ። ከኔ በላይ አቅም በላይ የሆነውን እንደ IOCD እና ቋሚ የቤተሰብ እቅድ አገልግሎትን እናቶች በመረጡትና እነሱ በሚፈልጉት መጠን ለነሱ ትምህርትና ተገቢውን ሁኔታ ለነሱ በማስረዳት ወደ አቅራቢያ ወዳለው የሕክምና ድርጅት ላይ እልካቸዋለሁ። ይህንን በምሰራ ሰዓት በአካባቢ በጀመሪያ በምገባ ሰዓት እጅግ ጥቂት እናቶች ነበረ ይህንን አገልግሎት የሚጠቀሙት። ነገር ግን በአሁኑ ሰዓት 898 የቤተሰብ ዘመናዊ የቤተሰብ እቅድ አገልግሎት እየተጠቀሙ ነው። እኔ ዛሬ እዚህ ለማስተላለፍ የመጣሁት እና አደራ የመጣሁት ዋንኛው ነገር እናትን ከሞት ለማትረፍ እንደሱ የተቀደሰ ስራ አለን የለም። ስለዚህ ላለፉት 8 ዓመታት ከጎናችን ሆናችሁ እናቶችን በመርዳት እኛንም ድጋፍ በመስጠት ስለረዳችሁን እጅግ አድርጌ አመሰግናለሁ። ለወደፊቱም እናቶችን ያለማቋረጥ የፈለጉትን የቤተሰብ እቅድ አገልግሎት እንዲያገኙ ደግሜ አሳስባችኋለሁ። እዚህ ውስጥ ያላችሁት በሙሉ ከኛ ጎን ሆናችሁ አንድ ሆነን የእናቶችና የህፃናትን ሞት ዜሮ ላይ አድርሰን ለወደፊቱ ያገናኘን። አመሰግናለሁ። ደግሜም አመሰግናለሁ።
I have no words to explain the dedication of the health extension workers in Ethiopia. If, those of us higher in the ladder work 50% as good as the health extension workers, we would have a different world. Now I will introduce a couple who have benefited from family planning program delivered through the health extension program. The wife, Mehret Tafari, is a 25-year-old married woman. She works as a cleaner in public facility. Her husband has a diploma and he is a civil servant. The couples who have 2 children, 4-year-old girl and 7-year-old boy. The family lives in a small semi-urban town in southern nationalities and peoples region of Ethiopia. She has been using family planning for quite a long time. She says, since I began using family planning, I have been able to work effectively, send my children to better school, and nourish them well. Her decision to use family planning was supported by her husband, who says, we discussed about using family planning because I believe that we have to plan our family in accordance with our income. I supported my wife in the decision making, and this decision has made a significant difference in our lives. Mehret is not only an advocate, but she has also managed to become a champion of family planning by helping 47 other women in her town to make decisions for uptake of family planning services based on their choice. I now introduce you Mrs. Mehret Tafari. ወይዘሮ ምህረት ወደዚህ ነኝ እንግዲህ
አመሰግናለሁ። እንደምን ዋላችሁ እላለሁ በቅድሚያ። እሺ፣ ስሜ ምህረት ተፈሪ ይባላል። የመጣሁት ከደቡብ ክልል ከጌዲዮ ዞን ከወናጎ ወረዳ ነው። እሱ ባለቤቴ ነው፣ አቶ ምህረቱ ፈለቀ ይባላል እና የረጅም ጊዜ የወሊድ እቅድ ተጠቃሚ ነኝ። የተጠቀምኩትም በአካባቢዬ በሚገኘው ጤና ጣቢያ ላይ የረጅም ጊዜ የወሊድ እቅድ አገልግሎት ተጠቅሜ ያለው እና የረጅም ጊዜ የወሊድ እቅድ አገልግሎት በመጠቀሜ በጣም ደስተኛ ነኝ። ቤተሰቤም ደስተኛ ነው፣ እኔም ደስተኛ ነኝ። ልጆቼን የጥሩ ትምህርት ቤት አስተምራለሁኝ፣ ጥሩ ምግብ ይመገባሉ። ምክንያቱም ይሄ የረጅም ጊዜ የወሊድ እቅድ አገልግሎት በመጠቀሜ ቤተሰቤም በጣም ደስተኛ ነው። ከባለቤቴ ጋር ተመካክረን ነው ይሄንን የረጅም ጊዜ የወሊድ እቅድ አገልግሎት የተጠቀምኩት እና እኔ ብቻ አይደለም ይሄንን ነገር ተጠቅሜ ዝም ያልኩት። ለ47 እናቶች ይሄንን የረጅም ጊዜ የወሊድ እቅድ አገልግሎት እንዲጠቀሙ አድርጌያለሁ እና አሁን እኔ የማሳስበው ነገር ቢኖር በጣም እኔ በኑሮዬ በጣም ደስተኛ ነኝ። ምክንያቱም የምፈልገውን ነገር አግኝቻለሁ። አንድ ጤናዬም ተጠብቆልኛል። ጥሩ ነው፣ በቃ ጥሩ ኑሮ ነው የምኖረው። አቅሜን ኪሴን እና ያገናዘበ ኑሮ ነው የምኖረው። እኔ ለኢትዮጵያ ሕዝብ የማስተላልፈው መልእክት ቢኖር ሁሉም ሰው እንደዚህ አቅሙንና ኪሱን ያገናዘበ ኑሮ ቢኖርና የቤተሰቡን እቅድ ቢመጥን በጣም ደስ ይለኛል። እና በመጨረሻ የማስተላልፈው መልእክት ቢኖር ለናንተ ለዚህ ጉባኤ ተሳታፊዎችም ሆነ ለሁላችሁም የማስተላልፈው መልእክት እኔ ደስተኛ እንደሆንኩኝ ሌላውም የህብረተሰብ አካል ይሄንን የወሊድ አገልግሎት ያላገኙ ብዙ እናቶች አሉ፣ በገጠርም በከተማ። ይሄንን የወሊድ አገልግሎት እንዲያገኙ ይሄንን የረጅም ጊዜ ሉፕ ማለት ተጠቃሚ እንዲሆኑ እናንተም የኔም ድጋፍ ቢኖርበት ጥሩ ነው ላለው አመሰግናለሁ።
Now you know why we talk about the Health Development Army. Eh? The next speaker is an Ethiopian legend. She is my all-time favorite athlete. Her name is Masarat Defar. She was born here in Addis. She's an Ethiopian female long-distance runner and currently holds the world's indoor record for 3,000 and 5,000 meters. Masarat is a highly decorated athlete. She has won 2 Olympic gold medals in the 5,000 meters race. Masarat is a UNFPA National Honorary Goodwill Ambassador in Ethiopia, championing the causes of women empowerment, adolescent and youth sexual and reproductive health, and HIV/AIDS. Masarat is married and has 1 child. Masarat has been successful in the 5,000 meters at the Olympic Games as well, taking gold at the recent 2013 Diamond League, the 2012 London Olympics, the 2004 Athens Olympics, and bronze medal at the 2008 Beijing Olympics. She has reached the 5 meters podium at every global final since 2004. She has won medals at top-tier international competitions, including Olympic and World Championship gold medals over 5,000 meters. She broke the world record in the event in 2006, broke it again in 2007, and held it until 2008. She is also a two-time champion at the All-African Games, a four-time medalist at the African Championships, and a two-time gold medalist at the World Junior Championships. It is truly an honor to introduce Masarat Dafar to you. Masarat, you have the floor.
Your Excellencies Prime Minister Hailemariam Desalegn, Your Excellencies Dr. Babatunde Oshotumen, UNFPA Executive Director Dr. Honorable Ministers, distinguished Member of Parliament, Excellencies, distinguished guests and speakers, ladies and gentlemen. I am delighted and honored to speak at this international event hosted by Ethiopia. This indeed a tribute to the remarkable effort my country put into expanding access to family planning, information and services over the past decades. It's also a gathering to look back on progress made on the commitment of the London Summit, held in ensuring access to family planning service for 120 million people in developing countries. I am pleased with the progress made in my country and in many others in ensuring the MDG target of achieving universal access to sexual and reproductive health, including family planning. This is vital in reducing maternal mortality and morbidity. It's also important in empowering women to participate more in economic productivity and in enabling families to invest more in educating their children. Family planning empowers women to take charge of their lives while enhancing their contribution to family well-being and overall national development. Family planning also increases the chance of girls' education, employment, and economy participation. I believe and advocate that the education of girls is a key step in protecting them from early marriage and childbirth, as well as addressing gender equality in economy participation. Improving education and access to family planning, therefore not option, but rather prerequisites for economic development. But beyond improving the health state of women, effort should also be made towards improving gender equality so that women have greater involvement in decision-making process and leadership position. This international gathering is an ideal forum that development countries, donors, international agencies, the private sector, and civil society to recommit to the commitment made at the London Summit. Personally, I am dedicated to voluntarily advocated for the implementation of the commitment my government made at the London Summit to further increase the funding to uphold the right of people to access and choose voluntary family planning. I wish you a successful conference. Thank you.
Mesrat, isn't that incredible? For those of you who have some ambition to win some medals, start training in Addis because of the high altitude here. I know some of you have some ambitions in that. We're closing the ceremony, but before we do that, we have some special announcements before I invite you to the reception. Let me call our friend Margot Funstock, the creator of Time Capsule Idea, to please come to the stage and explain to all of us, and we hope all of you can participate in the Time Capsule Idea, which you will see outside. Margot.
Thank you, Oying. I'm up here with Moni, and I'll introduce her and tell her story in just a moment. Good evening and greetings to honorable and distinguished guests and fellow family planning fans. Thank you also to those of you who have stayed till the bitter end here of the closing, last part of the opening ceremony. Sometimes when inspiration strikes, you just have to run with it. Last March, when Oying was looking for something creative and crazy to animate the International Conference on Family Planning, he explained that this year's conference would focus on how we would reach the ambitious goal of providing contraception to 120 million women by 2020. So I said, well, what if we created a time capsule that would capture people's ideas today in 2013 about how to reach those goals by 2020? And then we'll put it away, and in 7 years, we'll reopen it to see how we've done. Well, a few months later, I got a call from Oying, and he said, you know that time capsule idea that you had? We want you to run with it. And for those of you who know Oying, and even those of you who don't, you've probably surmised this evening, you can't say no to Oying. So fortuitously, the Hewlett Foundation at the time had just begun a collaboration with IDEO. IDEO is a design firm based in San Francisco that uses principles of human-centered design to tackle challenging social issues, including designing time capsules. So over the next several months, the IDEO team took what was just an idea, a silly idea at the time, and with passion, creativity, and a lot of energy, created a time capsule for us that is truly inspiring. So I'd like to take this chance to thank the IDEO team of Patrice Martin, Matt Taylor, Jade Gray, Ginny Wang, Stephen Kim, and Carla Lopez. And Jade and Matt are here this week. I hope that you get a chance to talk to them. And also I'd like to thank Christine Lee, who's a student currently at the Johns Hopkins School of Public Health, who served as our point person with the Gates Institute. So historically, time capsules were anthropological exercises. They were buried during celebrations such as the World's Fair and communicated with then future historians about the realities of a particular time. But people, as you can see behind me, also use time capsules to capture their personal lives. But our time capsule doesn't look like this. That's your cue. And it doesn't look like this. Our time capsule looks like this. So these are the voices of 2013. To give a face to the pledges made last year in London, we searched for stories from many countries all over the world, from partners of the Hewlett Foundation, to get stories about real experiences in using or accessing family planning. With the time capsule, I'll just have you keep going. There it is in all its glory. You'll meet Sadaf and Catherine and William, Mrs. Kamanga and Mrs. Ndugu. These people struggle with everything from how to transport women to clinics to how to get more men involved in decisions about family planning. And you are going to help them. You'll write your contribution on a sticker, just like this, and add it onto the time capsule to the many other voices that have already been heard. These will be your ideas of how to improve lives through family planning by the year 2020. And we ask that you write your name and your country if you're comfortable doing that. So after the conference, We're going to box up the time capsule. We'll put it away for 7 years, and 7 years from now, we'll reopen it to see how well we've realized our collective vision. So now I have the privilege to introduce Monira Akhtar, who you may recognize from the video earlier this afternoon. Monira is a nursing student in Bangladesh, and she was inspired by Catherine's question on the time capsule about how to design appropriate family planning programs for young people. And Monira is going to read us her response that she's already contributed to the time capsule on why she thinks family planning is important. Monira?
Thank you. I believe family planning is very important for youth because they play a vital role in controlling overpopulation. I learned the benefit of a planned family and bad effect of early marriage. So I decided to talk about family planning with my friends and family. I took a vow that I will share the message of family planning with others. Thank you.
Thank you, Monira, for your contribution. As I said, she's already made her contribution to the time capsule. So now I invite each of you to join me and Monira, I've made mine this afternoon as well, to make your contribution to the time capsule. It's right here out in the lobby, and you will be remembered then as one of the voices of 2013. Thank you.
Thank you, Margot. Thank you, Monet. So I would like to invite you to the reception outside and enjoy some music from the cultural show and from the beat-making lab. But as you prepare going out, let me just make a few announcements. First, please make sure that